Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Perinatal depression is depression that occurs in pregnancy and up to the first year after delivery. And it's quite common. It's well established that it's very common. It occurs in 1 in 8 women, either in pregnancy or during the postpartum period. We typically look at the symptoms occurring for at least a couple of weeks, and it's typically depressed mood. They may have low energy. They may have decreased appetite or increased appetite. They may experience difficulty sleeping, either too much or too little sleep. They may also experience changes in the way they think about themselves. They might feel worthless, or they might feel hopeless or helpless. Women often experience guilt and feeling bad about themselves, feeling that they're a burden to other people is a common thing that women describe. And in severe cases, people can also have thoughts of suicide. The difference between having physical symptoms of pregnancy versus depression is we look at how women think about themselves and how their thoughts change, and a lot of the symptoms do overlap. So for example, women may have trouble concentrating, or they may have changes in appetite or sleep or energy level. One thing that isn't normal and we don't expect in pregnancy is for women to feel bad about themselves, to feel worthless. We don't expect suicidal thoughts. We don't expect hopelessness, helplessness. We know that the perinatal time period is a very vulnerable time period for women, so often people can have a first episode of depression during that time period. So treatment options are non-medication treatment options, so there's a fair amount of evidence for interpersonal psychotherapy during pregnancy and the postpartum period. Cognitive behavioral therapy is another treatment option, and other forms of psychotherapy, and then medications are also a treatment option. Untreated depression itself has its own risks, and when thinking about seeking treatment or thinking about medications, to keep that in mind, and also to think about the benefits of treatment.
For more health news, stay tuned to Health Watch, or you can check on chartertv3.com and click on the Health Watch page.